Hello everyone, if you're new here, my name is Malki Assad, plastic surgery resident in the US, and today I have a very special guest to talk about a topic that you all have been asking me about. I have Dr. Sabi Kumar to talk about what is known as the Tennessee pathway or the Tennessee new law for IMGs. Dr. Kumar is a retired transplant surgeon and he is the representative for the 66th district in the Tennessee House of Representatives. Welcome Dr. Kumar to the channel.
Thank you. It's a pleasure to be here.
The pleasure is mine. I would like to start by asking you about this new law. We'll go over the details of it, but many ask, why do we need a law like that? We have many American doctors. Why do we need to bring people from outside the US to practice in the US without doing any training in the US?
Yes, there is a significant shortage of physicians, especially in Tennessee and especially in rural and needy areas. So to facilitate and bring more physicians into our state, this provides a new pathway so that physicians who are international graduates, they are able to come to Tennessee and practice for 3 years, 2 to 3 years under supervision. And if they perform well, their performance is satisfactory, then they can apply for an unrestricted license. There are certain requirements and qualifications needed. The physician has to be a graduate of a recognized medical school. They have to have 3 years of postgraduate training, or they must have practiced for 3 out of the last 5 years as practicing physicians in their home country. They should have passed ECFMG examination, and they should go ahead and take the USMLE, that is United States Medical Licensing Exam, Part 1 and 2. So with these qualifications, we opened a door that these physicians can apply for a position or a job within the state of Tennessee. They must apply only to institutions that have a postgraduate training program. And once these institutions will, of course, evaluate their application, investigate and speak to them, interview them, most likely online. Once they have done that, and if these institutions are willing to offer the person a job, then they can apply for a provisional or a temporary license to the Tennessee Board of Medical Examiners. At that time, they should also submit a copy of an application that shows that they have applied for a visa for entry to the United States. Having received the proof of an application is enough, and then the Board of Medical Examiners will again confirm that this person has those qualifications, that they have they are graduates of a medical school, that this person also has passed ECFMG as well as USMLE exams, and they have been accepted by a particular medical center that has a training program within the state of Tennessee. With these qualifications, the Board of Medical Examiners will issue them a provisional license. Now, if they have a job offered by an institution, and if they have a provisional license, then the visa applications becomes easy. They can receive a HB1 visa and be able to come to United States, work in that medical center for a period of 2 to 3 years, and if their performance is satisfactory, they will receive an unrestricted license for practice within the state of Tennessee. And this will help us to have more physicians and try to ameliorate our shortage of physicians.
That is a great summary of what the law entails and how the process works. And many of our viewers might not know that there is going to be a big shortage of physicians in the US. Many of my international audience think that we have a lot of physicians, and that is not going to be the case in a few years because there is expected in multiple states to have that shortage. So this is a great move from the state of Tennessee to ensure that the health of the individuals in that state are being covered by physicians. And you have made some multiple steps in this process to ensure the quality of these physicians, and we're going to touch on that in a few minutes. So one of the things that many ask is, when will this take effect? So if I'm an IMG listening to this video, I have these qualifications that you talked about. Can I apply tomorrow, or there is a specific date that this will take effect into?
Quite soon. The law becomes effective in July of 2024. And being able to make sure that the person applying does have ECFMG certification, has done the USMLE exams and so forth, and then approaching these various institutions, there are probably about 15 or so, maybe a few more than 15 institutions within the state of Tennessee that are conducting ACGME certified postgraduate training programs. So it's only a limited number of institutions that they can apply to, but the law does become effective in July of 2024.
Many mentioned that this is a big challenge for internationals getting this kind of jobs, because we're limiting them to ACGME training programs, and the bar to get into these places, be hired as a faculty, is much, much harder than private practices or smaller community programs. But I understand, the reason why behind that is to ensure certain qualities and certain kind of supervision. So what is your thought about that? Because how will you encourage these ACGME accredited training programs to hire people who did not do training in the US, where they have, I'm sure, other options of US trained physicians?
That is true, but at the same time, they are also affected by the same physician shortage that patients are affected by. So if there is a relative shortage of having physicians recruited to their programs, they would be open to this aspect, and this opens a new pool of physicians, the international medical graduates, that has usually not been available. Usually it's a much longer and arduous process, especially with obtaining visas. These graduates are capable enough and well-trained. They are able to pass the examinations. They are able to pass the CFMG, USMLE exams. So that is doable. However, getting a visa can be a 10 to 15 or 20-year pipeline, and that makes it very, very difficult, and the numbers are limited. Here we have taken the visa equation out, because if we provide them a job first, then they can apply for an HB1 visa for which they are qualified because they have a job application, they have job offer. Yes,
exactly.
That will make it much convenient. And the institutions, again, yes, the number of institutions is also rather limited. It's about 15 or 17 institutions within the state of Tennessee. But this, again, our needs being what they are, this is a very good start, and we hope that we are able to recruit and attract capable physicians to serve the population in Tennessee.
Definitely. And as I'm sure you are aware, Tennessee is the state that started a big move in the change in the law across multiple states. Now, Florida passed a similar law. Arizona passed a modified version of that law. Virginia, Wisconsin. So what is your thought about the change across multiple states, not only Tennessee?
Yes. I was quite impressed and overwhelmed when we discovered that Tennessee was the first state to do so. And the idea of this legislation was brought to me by an organization that known as the Cicero Institute. And actually, there was an article in the Wall Street Journal by one of the directors from the Cicero Institute, again, elaborating on the fact that Tennessee has opened a door, and now, as you mentioned, Florida, Virginia, and a number of other states, I think a number of 10 states, are already on their way to open their doors similarly. So it's become a competitive market for these states to attract international physicians. And yes, it is very gratifying to be the first state. And the bill that I passed was among the first. to accomplish this. And being a physician and being myself an international medical graduate, I can see how this door being open is very, very important. It's meaningful. It changes people's lives. It makes it possible for international graduates to come and live and practice in the United States. But above all, at this time, as a legislator, I'm serving my constituents, my Tennessee citizens. And to make more physicians available to care for these physicians, that is a very satisfying achievement, and I'm very proud of it.
And we as IMG community, I can speak on behalf on so many IMGs who were very, very happy to hear about this law, because it will bring a lot of qualified people to contribute to the community in Tennessee and other underserved areas. However, as you know, there is always, controversy and people who push back. And now I'm not sure if you heard, but the ACGME, ECFMG, and the FSMB, they are gathering to find kind of a common ground for states to evaluate these people, evaluate international, have some kind of common ground between all these states for people who are coming to practice without any training in the US. What is your thoughts on that? And has Tennessee talked to the ECFMG, ACGME regarding such kind of evaluation for these individuals?
I'm surprised, because ultimately the responsibility and duty of these organizations, ECFMG or ACGME, and us as legislators, our ultimate duty is to our citizens, to make medical care affordable and accessible to them, and to make physician access more possible for them. So rather than being concerned that ACGME feeling that we are stepping on their ground and we are providing an alternative pathway for more physicians to come in, I would invite them and I would approach them to come and join us. Let us work together. Ultimately, if there are physicians who are capable of providing care and our patients need care, let us make it easy and possible for them. And I think we should work together. These are very valuable organizations, and we recognize the contributions they make and the role that they have to play. Our job as legislators is, again, to serve our population and our citizens. But at the same time, we are not going to interfere with the functions of ACGME, because they make sure that the training programs that are available for these physicians and for all physicians are properly managed and capable, and they perform a satisfactory function that makes sure that the physicians who are going to in practice are very capable people. So I think I really respect ACGME as well as ECFMG, of which I'm a former graduate, to that the role that they are playing. And I want to compliment them, invite them to join the conversation with us, and let us work together to make it all possible, again, for the patients who need medical care.
One concern, Dr. Kumar, that a new article in the New England Journal of Medicine mentioned about the transition from the temporary to the permanent license is that what if somebody gets a permanent license that does not work in underserved area? The purpose was to bring international doctors to serve the underserved population. But are there any restrictions? Once somebody gets a permanent license, they can work wherever they want. So how did the state ensure that these individuals that we're bringing to cover a shortage, that they actually stay in the areas that they are needed?
Yeah, that is a very good idea. And yes, we did not place a restriction. But generally, availability being and the free marketplace being as it functions within the United States, jobs will be available in underserved areas mainly. The major metropolitan areas within the state of Tennessee do have sufficient number of physicians that jobs will not be easily obtained. We did not place a restriction that once that they finish their provisional training and receive a license, unrestricted license to practice, that they go to underserved areas for a few years. Florida has done that. as well as I think a few of the other states have also done that. And it would not surprise me if over the next year or two, we also decide to do that, place the same restrictions. But at this time, we did not place restrictions on where the newly licensed physicians under this program will be able to practice. I would encourage physicians who are watching this and plan to use this program to come to the United States. I would encourage them to work to be very proficient in English, because we are serving patients and citizens in Tennessee, and a language barrier should not exist. ECFMG did used to have a part where spoken English proficiency was tested, but I would encourage these physicians to do everything they can to learn English in a very comfortable way. So the answer may be to watch a lot of English movies.
Definitely, movies, songs, and although the Step 2 CS, which I actually did, I went to Houston to do the Step 2 CS exam, but was canceled due to COVID. Now they added, Dr. Kumar, an exam called the OET exam, which is not as strict as the Step 2 CS, but it kind of has some evaluation of medical English language so they can get their certificate. So there is some form of testing in order to get that certificate, which is already a requirement for the license. So this law is a huge change, and it's gonna transform, how we see healthcare in 10 years. But there are other small changes that we might make that might make a big change as well on the current system. For example, the J1 that is most physicians are sponsored on the J1 requires physicians to go back to their home country for 2 years if they want to practice in the US, or it restricts them to certain areas, and there is only very limited number of spots. So if we have a shortage of physicians, maybe we should also make a change on the visa level to allow doctors who actually train in the US to stay in the US if they wanted to. And another thing that came to mind, we see almost 40-50% of IMGs who apply to the match each year, who completed their Step 1, Step 2 CK, ECFMG certificate, they did rotations, they don't match. So maybe another consideration is to try to increase the number of training spots to cover that shortage, because we have qualified applicants who are applying each year, and because of the certain number of spots, they're not matching. Any thoughts about that?
Yes, two things. First, the situation where a person has passed their exams and they do not match. But I did pass a law about 2 years ago to give them the title of a graduate physician and allow them to work under supervision with board certified physicians within the state of Tennessee for a period of as much as 2 to 3 years, so that while they are waiting for a match next year or the next year, then they have employment, they're working in the medical field, and they can work in areas where medical professionals are needed. So we did pass a graduate MD law that allows these physicians to have employment under supervision with another physician as they try to match again. And I think the first point that you made, I have forgotten. Tell me again. What was the first point?
It's about the J1 restriction on IMGs and the requirements of going back to their home country or being part of the Congress program.
Right. My friend, that's a very, very difficult situation. That impinges upon federal immigration laws. And our federal immigration system, our federal immigration laws are in a state of extreme disrepair. It is very difficult to get anything done at the federal level. But I think there are some options available to these physicians as their visa expires. And I think they can, and in that situation, there are some medically needed areas that they can work in. And after serving there for a few years, then they can get an unrestricted visa or a green card.
We're going to end on a positive note. I'm going to have you give like a final, message for international graduates listening to this who are interested in the Tennessee pathway. What would you tell them to convince them to come to Tennessee?
I would tell them that America is a great country. The opportunities are endless and people are very kind. I have been in America now more than 50 years, and it has been the second greatest blessing of my life, first being my family. So America is a great country. Tennessee is a very good place to live, have family, practice medicine, and the medicine practice is also at a high level. So there are academic satisfaction to practice medicine at a higher level. And I would encourage them that, yes, the pathway is not easy, but with our bill and our law, we have made it a little easier. And I hope that they will take advantage of it and come and join in Tennessee, and they would be very proud. It's a very satisfying and a wonderful life.
Dr. Kumar, it was an honor to have you on the channel. Thank you so much for your time. I know you're super busy. Thank you so much for sharing this information with our audience.